Welcome to Defender's Voice. This is Dr. Paul. Thank you so much for joining us today. So, in today's episode, I would like to answer what are the best strategies to stop smoking. Now, remember one thing. It is always the best thing to stop smoking now. Okay, earlier the better. And some people say, well, it is too late for me. Actually, studies have shown, scientific evidence has shown that it is never too late to stop smoking. You can always, even after 70 years of age, 80 years of age, if you stop smoking, you will see the benefits of it. So first of all, let me describe the bad effects of smoking. Both active smoking and passive smoking are associated with the deterioration of elastic properties of the aorta. All right? And with the progression of carotid artery atherosclerosis. Smoking has also been associated with increased risks of leukemia, of colon cancer, prostate cancer, breast cancer. So a lot of cancers, the risk increases with smoking. Osteoporosis, Alzheimer's disease, cancers of the head and neck, cancers of the lung, esophagus, bladder. All right, all those cancers, they are high among people who smoke. So patients with head and neck cancer who continue to smoke during radiation therapy have lower rates of response than those who do not smoke. Olfaction and taste are impaired in smokers. They get so many facial wrinkles. Heavy smokers have a 2.5 greater risk of age-related macular degeneration. Children of smokers have lower birth weights. They are more likely to mentally retarded, have more frequent respiratory infections, and less efficient pulmonary function. They have higher incidence of chronic ear infections than children of non-smokers. So even children will face the bad effects of smoking. And in women, cervical cancer goes up with smoking. Women who smoke, they have higher lung cancer and pneumococcal disease and heart disease. They have endothelial damage and platelet aggregation. And they have higher rates of bladder cancer. The incidence of breast cancer also goes up. So our 41,000 deaths in the United States are attributable to tobacco smoke. 41,000 a year. Smoking cessation reduces the risk of death and of myocardial infarction in people with coronary artery diseases. And stopping smoking reduces the rate of death and acute myocardial infarction in patients who have undergone percutaneous coronary revascularization. It lessens the risk of stroke, is associated with improvement of chronic obstructive pulmonary disease symptoms. On average, women smokers who quit smoking by age 35 add about 3 years to their life expectancy. Men add 2 years to their life expectancy. So, if you stop smoking, your life expectancy actually increases. So, tobacco use constitutes most serious common medical problem if you leave it untreated. About 40% of smokers attempt to quit each year, but only 4% are successful. Persons whose clinicians advise them to quit are 1.6 times as likely to attempt quitting. Or 70% of smokers see a physician each year, but only 20% of them receive any medical quitting advice or assistance. So, how can you stop smoking? Number one, understand the risk factors. How many bad things happening because of smoking. Then go to counseling. Then go to pharmacotherapy. Okay? And anyone can give you counseling, like a health counselor can give you counseling and take you on that path. And all patients trying to quit should be offered medications, all right? Unless you have contraindications, unless you are pregnant or breastfeeding or a little child, you should give a thought to these medications. Weight gain occurs in most patients following smoking cessation. Some people gain as much as like 10 kilograms after stopping smoking. So planning for the possibility of weight gain and the means of mitigating it may help with maintenance of cessation. Now coming to another question, what are the best medications to use? Number one, nicotine replacement therapy. It doubles the chance of successful quitting. Nicotine is available as a patch, as a gum, or lozenges. Okay, you can get over the counter. Nicotine nasal spray and inhalers by prescription. Then there is bupropion. It's an antidepressant, but it is also effective in smoking cessation. And bupropion has minimal weight gain, but if you have seizures or risk of seizures, do not use it. That is contraindicated. So bupropion boosts brain levels of dopamine and norepinephrine. It mimics the effect of nicotine. Then there is Chantix, varenicline. It's a partial nicotinic acetylcholine receptor agonist. It has been shown to improve cessation rates. Its adverse effects, particularly its effects on mood, are not completely understood. Okay, so it can change your mood a little bit, but you can still give it a try. No single pharmacotherapy is clearly more effective than others. So you can go for nicotine or Chantix or bupropion, and sometimes you can even combine them like bupropion and nicotine and Chantix, like that. So if you do those things, I assure you that you can conquer smoking. Unfortunately, look at these teenagers who are vaping, right? Vaping is also dangerous, folks. And do not vape and do not smoke, because the long-term effects definitely will impact your health. So those are the things I wanted to share with you. Even if you fail once, a lot of people, actually majority of people fail on the first attempt. So don't quit if you fail after the first attempt. Sometimes you may become sick. Sometimes you may feel mood change, depression, stress, anxiety, withdrawal from nicotine. But don't give up. Go for the medication, go for the counseling. With these measures, you can definitely stop smoking and put your body on a path of healing. Okay, folks, those are the thoughts I wanted to share with you. Like this video, subscribe to our channel, and if you want any of this counseling or prescription for these medications, visit me in person in my clinic. I would be happy to help you. Thank you.